knock knock, hand hygiene. Hi, my name is Nicole. I'm a Harvard nursing student. I'm going to be doing your head-to-toe assessment today. Can you please state your name and date of birth?
Scott Prinesby, 10/13/1982.
Okay, and then can you tell me where you are?
I'm at the clinic.
And do you know why you're here?
I'm here for a physical assessment.
Yes. And then do you know the date today?
You just told me what it was, but I don't. It's 2016.
November.
November 19th?
I can't help you. Yes. 19? Oh, good job.
Yeah.
Okay. So he's alert and oriented ×4, and I can tell by his way of answering his questions that his speech isn't slurred. Also, he appears alert, which is that he's conscious, of course. And then I'm going to do the note that his skin color is appropriate to the ethnicity, which would be light fair skin color. There's no signs of cyanosis or jaundice that I should be concerned of. And then now I'm going to be verbalizing his height and weight, and I'm going to be using those two numbers to calculate his BMI. And then I'm going to test for his visual acuity using the Snellen eye chart. And that is when I'm going to have him stand 20 feet across from the chart and see what line he can read. And based on his correctness, I can calculate his vision score. And usually 20/20 is a normal vision. And then I would be taking his vital signs, which are his temperature, his blood pressure, his heart rate, his SpO2, and also his respiration rate. And I could say that his respiration rate is, within normal limits, or 16 to 20. And then heart rate is 60 to 100. And then I'm going to move on to his head-to-toe assessment of his head. So his size is round and appropriate to his body type. Yes, it's round. His shape is normal cephalic because it is also, like I said, appropriate to his body type. Then I'm going to inspect his hair, and I'm going to note that his hair is fine and it's evenly distributed. There's no bald spots or anything like that. And also, as I was inspecting his scalp, there's no lesions or lumps, bruising, or masses, and he doesn't have any infestations. So next I'm going to be palpating his temporomandibular joint, and I'm going to note any signs of crepitation. So I'm going to have you open your mouth. Yeah, sorry, not your joint. Okay, and there was none. So then I'm going to go and do his frontal and maxillary sinuses. The maxillary sinuses, I'm going to have apply pressure and have you note, is there any funniness or pain?
No, it's good.
Okay. So then now I'm going to move on to spatial symmetry, which is cranial nerve number 8. I meant 7. I'm sorry. I just froze. Okay, so it's spatial. I'm going to have you squeeze your eyes, and then raise your eyebrows, smile, frown. So that everything is evenly symmetrical, so his cranial nerve number 7 is intact. I'm going to move to his eyes and do the 6 cardinal positions of gaze. So I'm going to slightly move my, let's say, stylus, have you both eyes follow, and go slowly so it doesn't cause him any dizziness. And I can note that his cranial nerve number 3, 4, and 6 are intact. I'm going to be testing his accommodation, so follow the thing. Okay. So all right. So yes, like I said, his cranial nerve number 3, 4, and 6 are intact. So now I'm going to test his pupillary light reflex. And normally I would have everything dark, but because the windows, they allow light. But then I would note his pupil reflex to the light. All right, and I can tell that his pupils constricted when the light was on them. So I'm going to note his, also I'm going to, inspect his pupil size, and I can see that his pupils are equally round and reactive to light, and also accommodation. Now I'm going to inspect the conjunctiva, and his sclera. So his sclera is nice and white, and his conjunctiva is pink, so I can tell that he is hydrated. And now I'm going to move on to his ears, and I'm going to inspect and palpate for any tenderness or lesions. Is there any pain?
Nope.
And then I'm going to look inside, see if there's any cerumen, which there's not. What?
Oh, I was just happy that my ears weren't gross.
Okay, and then now I'm going to be testing his cranial nerve number 8, which is the whisper test. So I'm going to whisper, and then I'm going to have you repeat what I say.
White shirt. Gray shorts.
Okay, very good. So his cranial nerve number 8 is intact. So now I'm going to move to the nose. I'm going to note that his nose is symmetrical, and it's in midline. There's no lesions, any visible lesions or bruising. And then I'm going to palpate. Can you let me know if there's any pain?
No pain.
Or tenderness? No? Okay. So then I'm going to have, move on to test the patency of the nostril. I'm going to have you close one nostril with your finger and breathe in and out. Okay, I can tell that his nostrils are clear, so there's no signs of any colds or anything like that. So now I'm going to move to the mouth and the throat. So I'm going to inspect the lips, which they're well hydrated. There's no cracking, or they're also pink. And now I'm going to move on to the buccal mucosa. There's no, everything is nice, pink and smooth. There's no, lesions or anything like that. And then I'm going to go to the teeth. The teeth are white and all intact. His gums are accommodating to his teeth. His tongue is pink and rough. And then the dorsal side is smooth and glossy. And then I'm going to look at the bottom of his mouth for any oral lesions, which would indicate like they're like pre-symptoms of cancer and whatnot. And then after that, I'm going to look at his hard palate and soft palate. His hard palate has pink rugae, and his soft palate is nice and smooth and glossy. And then I'm going to check for the cranial nerve number 9 and 10, which is the uvula and his tonsils. So I'm going to have you say ah. Okay, I can tell that his uvula is midline and his tonsils are not inflamed. And then I'm going to have you stick out your tongue. And that's cranial nerve number 12, that is midline. So now I'm going to move on to the neck, and I'm going to inspect his parotid, sabillary, and thyroid. Okay, so here's the parotid glands. So forgot. Okay, and then his sabillary glands and his thyroid gland. None are swollen, or there's no tenderness either on palpation. Okay, so now then I'm going to do his range of motion of his neck. So I'm going to have you look down, look up, look to the right, look to the left, and then put your ear to your shoulder, put your other ear to your other shoulder. So now I'm going to move on to palpating his lymph nodes. We're going to start with the preauricular. So if you, I'm going to note for any tenderness or inflammation. So that was the preauricular, and then the postauricular, and then the occipital, and then the submental, the submandibular, the jugular digastric, and then the superficial, and the deep posterior cervical, which is down the chain, and then this the posterior cervical. And then can you shrug your shoulders? I'm going to check for the supraclavicular. So on palpation, there was no signs of any inflammation or tenderness or lumps or anything like that. So now I'm going to move on to palpating his carotid pulses. And with his carotid pulses, you always want to make sure you only use palpate one at a time, because it can result in death if you do two. So I'm going to check for the strength, and then make sure it's +2, which is a nice, strong, steady pulse, no abnormalities. And then after I palpate, I'm going to auscultate using the bell of my stethoscope to hear for, listen for any breweries or anything like that, which I don't want to hear. I just want to hear a nice upstroke swish. And that's what I do here. Okay, and then I'm going to do test for his cranial nerve number 11, which is the shoulder shrug against resistance. Okay, and then I'm going to have you turn your neck or your head. Okay, so I can tell that his cranial nerve number 11 is intact. And then now I'm going to move up to his upper extremities, which is I'm going to note for skin colors and note any lesions or bruises or abnormalities. And then I'm going to assess for the temperature. I can tell that his skin color, once again, is appropriate to his ethnicity. It's fair. And his temperature, as I move down, is nice and warm. Also, I'm going to inspect his capillary refill and his nail profile. So his nail profile is 160 degrees. There's no clubbing. His capillary refill is less than 2 seconds, which is a normal finding. So I can tell that he is also his skin is what is this? It's a okay, and then I'm going to check for the radial pulse to see if it's equal in strength. Note the rate and rhythm. And you can do this at the same time, which they are rate and rhythm, so it would be a +2 radial pulse. The strength is nice and strong. And then I'm going to move on to the range of motion of his elbows, hands, and shoulders. So I'm going to start with your hands. I'm going to have you bend, go down, up, spread your, and then come together, and then can you pull against resistance? Okay, good job. So that was your hands, and then your elbows. I'm going to have you go full like this. Okay, now I'm going to see if you can do it against resistance to test his strength. Okay, good job. And I'm going to have you stand up, or you can just, would it be easier for you to stand to your shoulders?
Sure.
Okay, so I'm going to have you, I'm going to hit you, but I'm going to have you raise your hands and pull it behind your back. And then I'm going to also have you go forward and then backwards. See how far you can, okay. So now I'm going to test for your strength on your shoulders. Can you go upwards against resistance? Okay, good job, you have strength. Now I'm going to move on to his chest. I'm going to assess his respiratory rate, but since we already checked his vitals, it would already be in that finding. And then I'm going to note the rate and rhythm and depth. He does not show any labored breathing. There's no use of accessory muscles. His chest is expanding nice and evenly. Even chest expansion on his inspiration and expiration. Also, I'm going to start with the inspection of his anterior and posterior chest. So if you want to just lift up your chest, I'm going to note if there's any lesions or bruises or anything. You do. Okay, so there's no any abnormalities of his chest. So now after I inspect it, I'm going to auscultate. I'm going to start with the anterior. So for the anterior, there's going to be 5 lung spots that you can auscultate for. Sorry. I'm going to have you breathe in and breathe out. If you ever get a little dizzy, just let me know and I'll have you sit down. And then I'm going to auscultate his posterior, which is 9. I'm going to listen to see if his lungs are filling with air. And I'm noting that so far his lungs are clear, which is a normal finding. And then on your right side, and then you can go on this side. Your right side, I'm going to listen to 3 spots because there's 3 lobes. On your left side, I'm going to listen to 2 spots. Sorry. Okay, so after auscultation, I noted all of his lung sounds are clear. Okay, yeah, okay. It's still
recording.
Okay, good. Sorry. And then for the bronchial sounds are noted more on the upper. They're more high pitched. The bronchial vesicular, as you move down, they're more in the mid line, and then the vesicular are low pitch, and they're towards the alveoli. And then I'm going to have you sit down. I actually lay down because I'm going to now inspect his jugular vein distension. So you want the head of the bed at 30 degrees, have them turn their neck, and note if there's any protrusion of the jugular vein, which there's not on hopefully a healthier person. Alright, that looks good. And then, so now after I inspected his neck vessels, I'm going to move on to his heart. I'm going to check the apical pulse for 1 minute, and that's always on the left side, right below the nipple. And a left up is 1. And then you're going to listen for a minute. Alright, so the minute is up, and I noted his apical pulse is, say, 64, which is normal. And then I'm going to have you, after that, I'm going to do, listen to your heart sound. So do you feel comfortable now? Is that fine with you?
Yeah,
just keep you there.
super comfortable.
So I'm going to look for the aortic, the pulmonic, the the tricuspid, and then the mitral. Okay, and then I heard the S1 and the S2, which is the love, dub, love for S1 and dub for S2. There's no abnormal heart sounds such as the S3 and the S4 because he doesn't have any congestive heart failure or anything like that. So now I'm going to move on to the abdomen. I'm going to inspect it by noting the contour and the symmetry to make sure that his contour is like his skin color, of course, again, is appropriate to his ethnicity. It's fair, and his abdomen also appears symmetrical. So now I'm going to assess the skin, the umbilicus, and there's slight pulsations in the abdomen. And then the skin, I already talked about. And then his umbilicus is appropriate. It's not protruding or anything like that. So it's all normal. So now after inspecting it and assessing his skin, I'm going to auscultate his ball scones in the 4 quadrants. So in his right upper and his left upper and lower left and right lower quadrant, they're all active bowel sounds. So then I'm going to proceed to palpate my patient's abdomen. I'm going to start with a light palpation of 1 centimeter and then move to a deep one, which is 5 to 8 centimeters. And I'm going to have you tell me if you're experiencing any pain or tenderness.
My stomach's kind of growling.
I don't feel for any masses or any lumps or anything in his abdomen. So after that, I'm going to move to his lower extremities. Oh, and then actually before I move to his lower extremities, I'm going to check for his the aortic and renal arteries. And I don't want to hear any bruise. And I'm using the bell of the stethoscope to do so. And everything sounds normal. There's no abnormalities. So now I'm going to move on to your lower extremities. And once again, with upper extremities, we're going to inspect for any lesions, bruises, his skin color, and temperature, which is warm all the way down. Your toes are a little cold.
They're really cold.
Do you normally have that?
I don't know.
Okay.
I mean, I'm not worried about it.
Okay. And then his skin color, of course, is appropriate to ethnicity, which is pale. Pale. Sorry, Claire. You're not pale yet. It's not much of a shot. And then I'm going to inspect his capillary fill of his toes, which is less than 1 second. I hope you have clean feet. And then I'm going to be palpating his dorsal pedis pulses. And you want to make sure they're present and equal in strength, which they appear to be. And then I'm going to palpate his pretibial edema to see if he has pretibial edema by placing my finger and noting if it's bouncing back his skin to normal, which it is because you're a healthy person. And then I'm going to, after I did that, I'm going to do the range of motion of his hip, his knees, and his feet. So I'm going to start with his hip. So I'm going to have you bend your knee and bring it forward. Oh, geez, okay, that's great. Bend it forward. And then I'm going to have you fold it to test abduction and adduction. Okay, that's good. And then can you do it with your other one? Okay, and then I'm going to have you lift one foot up for 5 seconds. Okay, and then bring it down. Other way.
Sorry.
Okay, now I'm going to do that. I'm going to have you do your hip against to test for the strength. I'm going to have you do it against resistance. Okay. Other way. And other leg. Okay. All right. And then I'm going to move down to his feet. I'm going to have him flex. So pull down. And then pull up. Okay. And then I'm going to have him do it against my resistance to see if he has equal strength, which he does. And then I'm going to have you sit up, and I'm going to do your knees. Or actually, you can stand. So I'm going to have you, for your knee, I'm going to have you just kick your knee like that with both legs. Okay, and then I'm going to have you do it against resistance. Okay, so maybe his balance isn't there, but he definitely has strength in his knees. So now I'm going to move on to your neurological test. So you can sit down if you would like. Or do you want to sit here?
Oh, sure.
So now I'm going to test for a light touch and have him close his eyes. And I'm going to be using a nice soft touch. So when I touch your skin, or when you feel, sensation on your skin, just let me know.
No.
I'm going to do it all over his body.
No.
Okay. All right. So after the light touch, I'm going to do sharp versus dull.
I'm not very good at this.
Get my utensils out. So I'm going to use this. I can feel that. That's a sharp, and that's your dull. So can you? And then I'm going to have you discriminate between the two.
Dull?
Yeah. Wait. Why are you freaking out?
I'm not good at this. Dull?
Sharp.
Was it sharp? Sharp. Dull. Sharp. Sharp. Dull.
Yeah. Okay.
Was it over?
What?
Never mind. It's
Yeah,
over?
so after I did his sharp versus dull test, I did it throughout his entire body, and I can tell that he has sensation. So I'm going to check his cerebellum function. Sorry, the lighting's a little bad, so I'm gonna try and fix that. So now with the cerebellum function test, I'm going to do the nose, finger to nose. Oh, is that better? Okay. So I'm gonna have you touch your nose and then follow my finger. Wow, you're good at this. Great game. Okay, good job. So after I do that, I'm going to do his heel to shin. So if you could just rub your leg against your shin. Great job. So now I'm going to move to his deep tendon reflexes. So I'm going to do his bicep and his patellar. So with the bicep, I don't have a hammer, but I can pretend to use this. So you're going to find his tendon in his bicep. So can you flex? Okay, so using my thumb, I'm going to tap my nail bed of my thumb, and then you expect to see a little flinch. And then for the patellar tendon, I'm going to have you go like this. And this usually relaxes the patient, so if he's going to, and then I'm going to hit him. Yeah, his legs attack. Okay, good job. So his reflexes are intact, and then I'm going to do his Babinski text. Sorry, I'm making you move a lot.
That's okay.
But if you lay down, I would use the I would use my thing that I checked with the tendons for his reflexes, the opposite side. Oh wow, I didn't get there. Okay. Okay, his reflexes are not inverted, so he is intact. Okay, great. And now I'm gonna have you do the Romberg test. So I'm gonna have you stand up, and doing so, I would do this for 20 seconds. Have his eyes closed, and have a normal position just in case he's leaning. So I'm gonna have you close your eyes, stand for 20 seconds. And if he was leaning either way, looking like he's going to faint, I would have him open his eyes up. Okay, so I can tell that you're okay with your Romberg test. And now I'm going to do his normal gait. So can you just walk there? Okay, so I can tell that everything appears normal. And then on your way back, your heel to toe. Wow, you already beat me to it. All right, so I can tell that he's not intoxicated. Now I'm going to do the spine. So I'm going to have you bend forward, and I'm going to lift his shirt up. Okay, I'm just going to make sure that his spine is in line. Okay, and then I'm going to have you come back up. So on that, I can tell his range of motion, and then I'm going to have you just hold your waist and then twist without moving your thing. Okay, so his range of motion is intact. His spine is midline, and then I'm gonna notice that his lumbar spine is concave, and then his thoracic spine is convex. And that would conclude our assessment of your head to toe. So thank you.